Hi there, Wendy. This is Lisa Furden with my second attempt at assessment. I am introducing you to Barbara. She
Hello.
is my patient, and we'll go ahead and start. So I would have washed my hands, given her the privacy, asked her if it was okay to do the exam, and I've
Yes.
informed consent. I would have pulled the curtain and had her empty her bladder for the exam. And I would start at the, can you see me okay? You can't see me. Huh.
And turn it a little bit. There we go.
Wait a second. Why can't you see me?
Okay, we'll back up a little.
Come, if you come towards me, does that change? Is that better?
Yeah,
There.
that's better.
Okay. So I'm going to start with her head. I will examine her head, making sure that it is symmetrical with no lumps or bumps. Examining her scalp all the way back, noting her hair, and her hair is evenly distributed, and there's minimal hair loss with no scalp deformities and no abnormalities of her cranium that I can feel. I will look at the skin of her scalp and see that there's no dryness and no flaking, and that her head seems to be a normal shape. I will come around and take a look at the front of her face now and examine the skin on her face, which is intact. Her face is normal symmetry. The bones seem normal. Her skin is intact, and it doesn't seem anything abnormal about her facial bones as well. And I'm going to just palpate her facial bones. And again, I don't see anything abnormality there. And now I'm going to look at her eyes and examine her eyes. And she has blue iris and white sclera and normal conjunctiva. And I'm just going to take a little bit of look at her campus, her inner campus here. It doesn't have any exudate in it. And I'm going to have her raise her eyebrows. Good. And smile. And puff out her cheeks and clench her teeth. And I'm going to have her close her mouth and against my resistance hold down her jaw. And then I'm going to take a look at her eyes, and with my pen light, I'm going to cross over and grab my pen light. I'm going to examine her pupils for equal reactive to light. I'm going to hold one open and look just past my shoulder. Look past my shoulder, straight over my right shoulder. Good. I'm going to go in and out, and her right pupil is equal and reactive to light. And I'm going to have her look straight over my left shoulder, and I'm going to say that her left pupil is about 4 millimeters and reactive to light. I'm going to stand in front of her, which I don't know if you can see, and I'm going to have her follow the gaze here. And from here, can you see us? I'm going to test the 6 points of gaze and just have her follow my hand and over here and making a star. Don't move your head, just your eyes, thank you, and all the way up, and back to center. Good. And now I'm going to have her test for, I forget the name of it, but cover your right eye, Barbara, and I want you to tell me when you can see my hand.
Now.
Okay. And I'm going to go down the bottom and have you tell me when you can see my hand, and opposite, cover your other eye, and I'm going to have you tell me when you can see my hand. Okay. And I'm going to have you tell me when you can see my hand. Okay, uncover. And now eyes are equal and reactive. I don't notice any abnormalities. I'm going to take this away. Ears. We're going to examine her ears now. So her ears are symmetrical. I don't see any abnormalities of the skin of her ears. I am going to pull back and see if she has any tenderness here. Any tenderness here, Barbara? And this is an auricle. And go ahead and pull back, and any tenderness there. And now I'm going to push on the tragus and see if there's any tenderness there. No tenderness there. And over here, any tenderness there. Okay. So now I'm going to come to her far left, and I'm going to do what's called the whisper test. I'm going to say something in her ear, and she's going to tell me what I say. So, 99.
99.
And I'm going to come to the other side, and I'm going to have her say it again. And we're going to go 1, 2, 3.
1, 2, 3.
Okay, so that seems to be intact. I'm going to take a quick peek in the ear. It seems pink from what I can see. Again, I don't have the right equipment to go any further than this, but I don't see any exudate, any wax on the outer part at all. So there's ears. And now I'm going to go to the nose. So her nose is symmetrical, and she has no open areas that I can see. Her ears are clear. I'm going to have her cover her right nostril and breathe in and breathe out. And I'm going to have her cover her left nostril and breathe in and breathe out. Good job. Okay, so that works. If I had an otoscope, I could look a little bit deeper, but I don't, and I don't see any abnormalities. I'm going to move down to her mouth. I'm going to have her open up her mouth and say, ah, and stick out her tongue. Good. Head back just a little bit. I'm going to examine, see if I can take a look at the tonsils, which I can see, and there's no redness, no exudate. And lift your tongue up. Good. And to the right and to the left. I don't see any abnormalities of the mucosa. Go ahead and show me your gums. And I don't see any abnormalities of the gums. They're all pink and intact with no drainage that I noted. And her breath is wonderful. I'm going to go on from there. So head, eyes, ears, nose, mouth. I'm going to check her sinuses, her frontal sinuses and her maxillary sinuses. I'm sorry, I'm standing in front of the thing. I'm also going to test her. I'm going to check her, palpate her temporal artery. And then I'm going to come down and check her TMJ. Go ahead and open up your mouth bar and close it and draw right to the left and right to the left. She does have a slight click on that left-hand side, as she did the other day as well. Okay, so head, eye, ears, nose, throat. I'm going to come down the front and notice her trachea is midline and it's soft, and I don't notice anything abnormal there. And I'm going to have her turn her head all the way to the right for her range of motion of her neck, and all the way to the left, and bring your ear to your shoulder and against my resistance all the way up. Good. And your left ear to your shoulder and against my resistance for strength all the way up. I'm going to have you put your head all the way back and all the way front and forward. Any tenderness there?
Oh.
Good. And at this point, I'm going to palpate her carotid artery one at a time so I don't give her a stroke. And palpate the carotid artery over here. I'm going to examine the lymph nodes before I go anyplace else. And I'm going to start posterior and anterior and submandibular and here. And then I'm going to come down here, across here. And I don't notice any abnormalities. I come across here. And turn your head all the way to the right and all the way to the left. There's a small node here that I'm going to see if I can. And we'll go from there. So moving on from the neck is normal. Trachea is midline. There's no abnormalities there, no history of trauma. I'm going to come to the thorax now. So I'm going to have the posterior thorax, take the posterior view first, come behind the patient, note the skin, but first I'm going to palpate the thyroid from the posterior procedure. Go ahead, and so I'm going to palpate and have you swallow, and I can feel it go up and down, and I don't feel any abnormalities of swelling, and she doesn't have a goiter. And one more time, go ahead and swallow. Good job. And now I'm going to have her sit just a bit forward. I'm going to pretend like her skin is exposed. I'm going to have her take a deep breath in and exhale. Good job. One more. And she looks symmetrical. Her shoulders are symmetrical. I don't notice any abnormalities of her skin. I'm palpating. I don't feel any lumps or bumps or abnormalities all the way down. Her spine is in the center. I'm going to auscultate her lung sounds from behind using my stethoscope and have her take a deep breath. Take a deep breath in. Exhale. There's one. Over to the right. Deep breath in. And two. Good job. Down. Good. And one more. Good job. So her lungs are clear. Don't stop my video If you touch that, it will stop. Please sit
go
forward.
right.
I'm going to check for CVA tenderness now. Putting my hand over the 3 and a little, any tenderness there,
No.
Barb? And over here, CVA tenderness, 1, 2, 1, 2. If you stop, then we have to repeat the whole thing. Unfortunately, I can't figure out how to
It's going dim.
start. Oh, we're going dim. I'm sorry. Okay. So I've tested for CVA tenderness. I've checked her lung sounds from behind. I'm now going to sit her forward. I'm going to come over here and I'm going to go ahead and listen to her lung sounds in the front, which I failed to do in my first attempt. So go ahead and listen to her lung sounds. And we're going to listen. Actually, I usually listen. Take a deep breath. Good. And again. And again. And again. Way under. 1 deep breath. Sorry, Barb. And sorry, Barb. I'm now going to listen to her apical pulse. Okay, I'm going to, from this point, take a look at her upper extremities. And I'm going to look at her hands and her wrists and her arms. So I'm going to have her hold her hands out. Just going to move this stuff back a bit. Can we see? You can see. Good. Spread your fingertips. Good. And show me your palms. And clench your fists. And bend your arms. And push against my resistance. And pull against my resistance. Good job. I'm going to test her radial pulse. I'm going to test her brachial pulse. I'm going to try and get her interocular node. And ask Barbara to stop drawing on her knee. I know, Wendy, thank you for your patience. I'm going to have you check your radial pulse, and it feels normal, and brachial pulse, and that feels normal. And I'm going to try and get that ectrochlear gland lymph node and see if I can feel that. Good job. Come all the way down. I'm going to have you raise your arms up, all the way up over your head, and all the way out, and behind your head. Good job. And I'm going to have you come all the way back up and bend down.
That's my toes?
No. Just bend here.
Oh,
good.
Sorry.
And the arms behind you. Good. And all the way back. I'm going to have you shrug your shoulders and push against my resistance. Good job. Okay, so head, eyes, ears, nose, throat, heart sounds. We're going to check some heart sounds now, starting with the second intercostal space for Erd's point. So we can count down 1, 2. Actually, you know what? At this point, we are going to have Barbara lie down. So Barbara's going to lie down, and we're going to fix this camera so you can see. Wendy, again, doing my best for memorization. We're going to assess for JVD. So have her turn her head all the way to the right. Good. And I actually can see it. And I can see the carotid, and you're going to go all the way this side. And again, on this side is more pronounced like it was the other day. I'm going to let her have a little bit of, sit her up a little bit for comfort, and to go ahead and you can lie back. Good. And from there, now I'm going to listen to heart sounds. So start 1, 2. I'm going to start there. And now we're going to move over to the third intercostal space on the right side. And 3. Tricuspid. First one's mitral. Last one's mitral. This one's mitral. And an apical pulse. And using my imaginary watch, it's about 60. I'm going to have her turn to her side. Yep. And exhale. Okay. And back. You can move back onto your back. Now I'm going to assess her abdomen, and her abdomen appears flat and soft. Her pelvis is midline. She has no history of abdominal surgeries.
No.
And no history of nausea, vomiting, diarrhea, and currently no abdominal pain. Okay, so I'm going to take a look and everything looks good. I'm going to auscultate her bowel sounds, starting with her right lower quadrant. And then we will go to her right upper quadrant. And then we would go to her left upper quadrant. And then her left lower quadrant. And I hear bowel sounds, soft bowel sounds in all 4 quadrants. From here, I'm going to percuss 3 times in all 4 quadrants. 1, 2, 3. 1, 2, 3. 1, 2, 3. Testing for tympani. And up to the right upper. 1, 2, 3. Didn't do this the other day either. 1, 2, 3. 1, 2, 3. And a crossover. 1, 2, 3. You okay?
Absolutely.
1, 2, 3. 1, 2, 3. And 1, 2, 3. 1, 2, 3. 1, 2, 3. And from here, I'm going to do light palpation of each quadrant. Any pain? No. I wouldn't do deep palpation unless I was an NP or a physician. Any problem?
Not at all.
Not at all. Okay, good. And then going back, I would go back to my 5 points for my cardiac and double check and listen for abnormal sounds in the same points I did for the beginning. So, second intercostal space, third intercostal space, right side, third intercostal space, left side, and fourth intercostal space, left side, and fifth intercostal space, right side. Okay. From here, I'm going to test the flexion, extension, and strength of her hips. Again, her hips are equal. I don't notice them to be off. There's no shortening of her legs. There's no internal or external rotation of her feet. So I'm going to have you raise your right leg all the way up. Good. And all the way down. And go ahead and bend your knee. And put your foot down and bring your knee out to the side. Good. Does that hurt at all? And back into center. And come all the way out. And now we're going to bring your left leg all the way up. Good. And bend your knee. And bring it out to the side. And bring it back up. And all the way down. I want you to lift your legs against resistance for me if you can. Good. And push down on the gas pedals. And toes towards the nose, pulling towards my feet. Good. I'm going to go ahead and test her pulses. So I'm going to test for her popliteal pulse. And her posterior, well, dorsalis pedis is the top, posterior tibial. And on her right side, popliteal. And we're going to check for her dorsalis pedis. Good. And the posterior tibial. I'm going to have her spread her toes wide. Good. Curl your toes. And again, push your toes down and pull them up. And from here, I'm going to test the Babinski. There we go. And there we go. All right, extremities. Bend your knees into your chest. Good. And all the way up. And you can come on up and have a seat. Back. We can do it from here. Okay. So from here, we're going to do a couple of tests. We're going to have Barbara close her eyes. And we're going to give her an object in her right hand. And what is that?
That's a coin.
Right. And we're going to give an object in her left hand. And what is that?
It's a pebble.
Okay. And then I'm going to take your hand. And I'm going to turn your hand. And which way direction is your finger going? And which way is your finger going now?
Up.
Okay. And now I'm going to test your right hand. And which way is it going now? And again on the left.
Up.
Okay. Good job. Okay, now I'm going to take my tissue. I'm going to touch you on different portions of your body. You're going to tell me where I'm touching.
My right cheek.
Yes.
My left cheek. My right upper arm. My left upper arm. My left leg. My right lower lip.
Good job. Okay. So now I'm going to have you stand up. You can open your eyes now. Don't know where we are, Wendy, but if you didn't lose us, I'm sure. But now Barbara's going to walk. So I'm going to have her turn and take 6 steps this way, forward. Good job. And now I want you to turn. Good. Now you can see her feet. You can't see me though, so I'm here. Go ahead and walk heel to toe, Barbara. Heel, toe, heel, toe. Good job. Heel, toe. Okay. Now you can go ahead and turn. I want you to take, say, 5 steps on your toes. You okay?
Yeah.
Turn around and you can take some steps on your heels now. Good job. I'm right here. And now I'm going to have you put your hand on here for balance. I'm going to test for Romberg. So you're going to close your eyes. Now you can put your hand down. And for 20 seconds, I'm going to stand by you. I just want to see if you go to the right or the left, testing your cerebellar function. And it doesn't look like she's going anywhere. I'm down here. Okay, so go ahead and open your eyes. Put your hand here, Barbara. I'm going to have you bend your right knee and go down, all the way down, deep squat. Good. And now do the opposite. Bend your left knee and go back down and come back over here. And now have one seat for me while I quickly go back here. Wendy, I'm taking a quick gaze at my paperwork to make sure that I have done as much as I possibly could have done to get through this. And I believe I'm going to go ahead and say I'm done here and see how this goes. Again, thank you for the opportunity, and I appreciate the opportunity for a second shot here. Thanks a lot. Have a good day. Where are we? Stop recording.